Hi, this is Dr. Scott McMahon. I'm the host of Medicine and Miracles. And today we're going to start a brand new series looking at the symptoms of CIRS. This is our 25th episode. So for you, we're going to go through each symptom one at a time so you can have a better understanding of what it is. Now, today's symptom is very common. In fact, it's one of the most common things we see. It's chronic fatigue. And about 95% of the adults who have CIRS have chronic fatigue to one degree or another. Now, this isn't, I went to the gym and I worked out and now I'm really tired. No, this is total exhaustion by the end of the day or by the end of your workday. This is like, when I get up in the morning, I have to choose between vacuuming and washing my hair because I have so little energy. Or this is like, I am so tired, I can't even get out of bed this morning. And so I stay in bed all day long, except hopefully to go to the bathroom. Hopefully you go for that. Now, it doesn't usually start out that way. Okay. And what it usually starts out is you have all these good days and occasionally you have a bad day. And then as time goes on, you start having more and more bad days and more bad days until the good days are actually kind of rare or maybe totally gone. And that's what happens as your chronic inflammatory response syndrome continues. And you can be bone tired every day and maybe even most all day long. And it's really awful. Now, there's several reasons why that can happen, and I'm going to go through all three of those. The first one is what we call cellular reasons. The second is because of poor sleep, and the third one has to do with just your mood and your affect. So let's go through each one. Now, when you look at the cells or the cellular level, we use a test that's called Gini. It's a transcriptomic test that shows us what's going on in the cells. Now, those are some big terms, but basically what we can see is what the cell inside the cell is actually making, what kind of products it's making, primarily proteins. And based on what it's making a lot of or what it's not making much of, we can get a sense of what's actually going on and affecting the cell to make those kind of decisions. Now, first, you got to understand that to make energy in your cell, you got to have glucose, or that's a fancy word for sugar. And glucose comes into the cell, and depending on how you process it, you can make 2 units of energy, which we call ATP. And I'll stop here for a second. ATP is pretty cool because you make the energy and then you can transport that ATP anywhere in the cell that you need, and then you can release the energy there. So it's kind of like a battery in that you can transport it and it'll provide energy wherever it goes. So you can make 2 units of that kind of energy using one method of breaking down the glucose. But if you use 3 methods, and we'll go through each one real quickly, if you use all 3 methods, you make 38. Well, theoretically 38 is probably closer to 34 to 36, but you make a whole lot more of those units of energy when you go through all 3 processes. So again, let's just talk about them real quick. The first process happens in the cytoplasm, fancy word for the jelly or the goop of the cell. And that process is called glycolysis, which literally means to take glucose and break it in half. And you break it into half and you get 2 units of energy out of that. And you end up with 2 molecules of a chemical called pyruvate. When you put the 2 pyruvates together, you get glucose. When you break the glucose apart, you get 2 pyruvates. Now that's glycolysis, and that's just 2. If you want to get those other 34, 36 units of energy, you have to take those pyruvates out of the jelly, the cytoplasm of the cell, and you have to put them into the mitochondria. Mitochondria are like little capsules, and they have 2 membranes. They have an outer membrane and an inner membrane, and you have to get the pyruvate out of the cytoplasm into the mitochondria for you to do those other reactions. And you have to get other chemicals in that are made in the cytoplasm. You have to get them into the mitochondria for that to work. Now, when you do that, you've got two other steps. One's called the Krebs cycle. The other is called the electron transport chain. There we go, the ETC. I'm going to tell you that is, both of these are very complicated. They each have like about 9 or 10 different reactions that go on. All you need to know is that if you go through the Krebs cycle and the electron transport chain, I've been saying this for 40 years. I can't seem to get it out today. If you go through both those processes, you make a whole lot more energy. But both of those, to do either one, a Krebs cycle or the ETC, you have to get the raw materials from the cytoplasm outside the mitochondria into the mitochondria. So out of the cell jelly into the mitochondria. Now, Jeannie shows us why that isn't happening in CIRS patients. There are 4 different choke points that are occurring that make it difficult for you to go from 2 units of energy to that 38 units of energy. Now, the first one has to do with what are called ribosomes, another fancy name. Ribosomes are the part of your cell in the cytoplasm that make proteins. So they take signals called mRNA, which you may have heard of because the COVID vaccination was an mRNA vaccine. So we shot mRNA into you, and then your body actually made the spike protein in your own cells, which is not such a wise thing for some people. And then you made antibody against it. That's the way the COVID vaccines work. But the ribosomes take that mRNA that comes from the nucleus, we'll go into that briefly, and it makes chemicals that are necessary for the things that happen in the mitochondria to occur to make that extra energy. And what we see in CIRS patients, most of them, is those ribosomes are not making as much protein as they usually do. The second thing we see is that there are ribosomes doing the same things that are actually inside the mitochondria. So they're making some of those chemicals inside the mitochondria, but they're not, in CIRS patients, making as much protein as they usually do. And so you don't have as many of these chemicals that are necessary for these 2 processes to work. And so you don't make as many units of energy. And then a third thing that happens is some of these chemicals that are needed actually start in the nucleus of the cell where the DNA is. The DNA gets copied. We call that transcription. And that's how the mRNA are made. Those mRNA come out into the cytoplasm or the jelly of the cell. They go to the ribosomes and the proteins are made. But guess what? There's less activation of those genes inside the nucleus. So again, you're decreasing the amount of proteins that are being made. And finally, there's a particular kind of protein that's made that's called a translocase. Its job is to take that pyruvate and other raw materials that are actually floating around in the jelly and actually transport them into the mitochondria so they can do their business. Okay. Well, guess what? You're not making as many of those also. So you've got 4 different choke points. Any one of those can reduce the amount of energy that's made by the cell, and you've got 4 of them. And so each individual cell in your body is not making as much energy. And when you look at that globally, all your cells not making as much energy, guess what that means? You don't have any energy. And so you're fatigued because you're just tired because you're not making the energy to go and go and go. Now, on top of that, there are also some people who have taken systemic antifungals, and we don't recommend systemic antifungals, but certain ones like itraconazole can actually block the little doorway from the cytoplasm into the mitochondria. We call that the VDAC channel, or voltage dependent anion channel. It can actually block that and keep all those chemicals and resources and whatnot from going from the jelly of the cell into the mitochondria. And so for another reason, this one is because your doctor gave you systemic antifungals, you continue to be tired. Now, why does that make you tired? Well, if the cell itself doesn't make enough energy, if it's instead of making 100% of the energy it can, it's only making 5% of the energy that it can. That's 2 versus 38, 5%. Okay. Then what that means is your cell has to take what little energy it's making and it has to ration that. It has to choose what it's going to do. And one of the functions that it may turn off is the cell, for instance, detoxing and getting rid of the stuff that's in the cell that it needs to get rid of. There may be other things that it has to do, but the cell is just not going to be able to perform the way it usually does. And when you, again, look at that globally, it leads to chronic fatigue. Now, that's a lot about cellular mechanisms, and that's probably the most important one in CIRS. But let's shift gears a little bit and let's look at sleep. 98% of adults that have chronic inflammatory response syndrome have what's called non-restorative sleep. What that means is whether you sleep 3 hours or 5 hours or 14 hours, you do not wake up rested. You did not rest your body overnight, replenish. You didn't rest your brain, and you wake up tired. Okay. Now that results usually as a result of low level of MSH, which we find in well over 90% of CIRS adults. MSH works on the hypothalamus, which we've talked about before. It's the main organ of regulation in your body. And if it's not working well, you get non-restorative sleep. There are other things that can add into that. There are other hormones that can affect your sleep cycles. Your autonomic nervous system may be out of tone, and that can affect your sleep. But when you have poor sleep, and particularly if it's chronic and maybe you have other things like pain syndromes or whatnot, but when you have poor sleep, it leads to chronic mental and physical fatigue. And finally, let's talk about affect and how affect affects the fatigue. Okay? Affect is a fancy word for your mood. Right? Negative moods create a decrease in your energy, or at least how you feel you have energy. You have a loss of vigor when you're in a negative mood. And then inflammation in your brain can affect your affect, and it can lead to chronic fatigue also. It can also lead to depression and anxiety and a lot more. So your affect is important, and the inflammation going on in your brain is a bad thing. So if you want a more thorough and easy to understand explanation of all these processes that I mentioned, you can find it at www.cirs.com/patient-resources/. Wow. Okay. You can find all of this information broken down in videos that I've done on different parts of the body so that you can understand how the body works and then understand how CIRS messes with that. So those are at cirsx.com, and they are amazing. They were done just for you, and they're at about a 5th grade level, so pretty much anyone can understand them. Okay. Now you'll find a lot of other free videos and resources at www.cirsx.com, but the glossary is the bomb. I said .bomb, but it's .com. Okay. There's also a series of videos which explain everything about the body and how CIRS affects it in another group of things, just looking at the physiology. We call those doc talks, and those are on cirsx.com. You can also find a list of treating professionals if you think you might have CIRS at survivingmold.com, or you can go to www.moldco.com, where you can get direct to consumer services, so where people will assess whether you may or may not have CIRS and lead you down the pathway of treatment. You won't find a better price, and you won't get access more quickly anywhere. Okay. Finally, the ultimate in the learning experiences about CIRS is at the Surviving Mold CIRS X annual meeting. This next one is going to be in Tempe, Arizona. It's June 5th to June 8th. 2025. To find out more about it, go to www.cirsx.com. And if you use the coupon that I'm giving you, it's Dr. Scott, DRSCOTT 10, you'll get 10% off the price of the conference. So do that today. Now, one of the purposes of this podcast, remember, it's called Medicine and Miracles, is to remind you that miracles still happen. Now, I met a man about 2 months ago who had an amazing story. He was in his late 40s, and about 8 years ago, he was sick. He had diabetes, he had high blood pressure, he had more. And he was getting sicker and sicker, even though he was taking his medicine, trying to watch his diet and whatnot. And he ended up having a stroke. And he went to the hospital. And as a result of the stroke 8 years ago, he died. Now, while he was dead, he was transported to hell. Right? He saw hell. And what he realized was that even though he proclaimed that he was a Christian, he was going to go to hell. Why? Because he held unforgiveness in his heart for many, many people that had harmed him. And Jesus came along and sent him back to earth to tell Christians, you and me and others who believe, that they have to forgive others as God has forgiven them. In fact, if you refuse to forgive people, then God cannot forgive you. It says it in the Bible right at the end of the some people call the Lord's Prayer, the disciples' prayer, our Father who art in heaven, hallowed be thy name, thy kingdom come, etc. At the end of it, it says that if you will not forgive others, then God cannot forgive you. And to the extent that you forgive others, God will forgive you. That's a hard word today, but it still is the truth. Now, because this man hadn't forgiven others, he could not be forgiven of all his stuff. And so he was going to go to hell if he had stayed dead. But fortunately, after about 6 hours of being dead, he came back to life. He was naked. He was covered by a single sheet. He was in total darkness. It was very cold. In fact, he had been taken to the morgue. Most people don't know this, but most hospitals have a morgue like in the basement. He had been taken to the morgue of that hospital. They had opened up the door, put him on the gurney, and shoved him in and closed the door. And that's where he woke up, probably waiting for an autopsy. Fortunately, he didn't have an autopsy because that would have been bad. Anyway, he returned to life. He still has diabetes. He has a limp from the stroke, but he's alive, and he has this message: forgive others if you want to be forgiven. Well, wow. That's an amazing story. And all the glory to God, because God is the one who raises people from the dead. So, wow, isn't he good? Now, finally, we always try and leave you with an uplifting thought for the day. And today we're going to go to Psalms 23, just the first verse. It says, the Lord is my shepherd, I shall not want. The Lord is my shepherd. I don't have a want for anything. Okay. The Lord as my shepherd, like I'm a sheep, he guides me wherever I go. And sometimes it's the places I don't want to go and things I don't want to go through. But he guides me and he keeps me safe and he provides everything that I need. And because he provides everything that I need, I don't have a want for anything else. And because of his tender care, his loving care toward me, all I want is more of him, to spend more time with him, to know him more deeply. That's all I want. Well, that's it for today, folks. Thank you again for joining us. And if you liked what you saw, if you learned anything new today, then hit like and subscribe. Okay. And join us again for our next episode of Medicine and Miracles, where we find that the mysteries of the human body intersect with the unsearchable God. Thank you very much. God bless you. Goodbye. I'm Dr. Scott McMahon, your host of Medicine and Miracles.